everybody, this is Dr. Jones, CEO and founder of Colorado Medical Solutions, and today I am just so excited because what we're here to talk about today is what I consider revolutionary. It's important that I really reiterate our company's mission statement, which has always been to reduce prescriptions, prevent surgeries, and restore optimal health. And so I'm always looking for procedures that do that. And not only does this procedure, I think it does that, but also it may even be covered by your insurance. And with all this craziness that's going on right now in the world right now, and what that means for our financial situation, to be able to partake in a procedure that I think is very powerful, and so do many others, and have it actually be covered potentially, it's kind of a no-brainer. And so today we're going to talk about that procedure. So I am a chiropractor by trade, and what I do for Colorado Medical is I put together the clinics, hire the right medical staff, and help educate them and get a better understanding of these procedures so that when they begin to do it and administer them, they get to share in the same experience that we do as holistic practitioners, which is helping people get healthier and get better. So without further ado, guys, let's just get right into it. So we are Colorado Medical. I do think this procedure is very powerful, and it's got some really good potential. And when we think about what's going on here, folks, that never-ending pain cycle and being able to end our pain, well, what does that mean? Because we hear that all the time, and there are many things out there in the market that can end your pain, but to actually potentially do that with a therapy that's more holistic in nature, that's where I hope I'm grabbing your attention, folks, and that you're really tuned into that. So today's a day to be excited, not just because I like to have fun when I do these presentations, and I hope you do enjoy your time here today, but more importantly because this is a big topic. We're talking about that never-ending pain cycle that causes you to get up in the morning and have frustration about the day. You know, you spend your entire life sacrificing and saving so that you can get to retirement or near retirement, enjoy your time, and a lot of people can't even do that nowadays because their freaking body hurts and they're not enjoying the quality of life and they're suffering. And what we're talking about here is a therapy that may actually end that pain cycle, and you know, it's a big deal. And I hope we can get this message out to the masses. So regenerative medicine, what does that mean? It's a different way of thinking, because if you think about traditional medicine, prescriptive drugs, anti-inflammatories, physical therapy, cortisone shots, minor surgeries, medical durable medical bracing for knees and backs, and you know, the body's still breaking down, right? We can't stop the body from breaking down. We can slow it down, we may temporarily stop it, but the body's always breaking down. But when we look at regenerative medicine as a whole, and there's many different procedures that make up regenerative medicine, we're talking about things that either on the strong end regenerate, and on the weak end complement the body's regenerative ability. And so this has got some promise, and I think where the majority of our time and focus should be as healthcare practitioners when we're talking about these types of conditions, these musculoskeletal type conditions. So we're not just getting older, folks. Okay, well, we're getting older, and that's just the reality of it, and I can't do anything about it. But with regards to how we feel, right? And that's important to understand. You know, you can be 80 walking around like you're 50 years old, and I've seen some 50, 60-year-olds look like they're 80. And I think a lot of because age is relative, right? And it's how you feel. Well, how you feel is strongly impacted on how your body's doing. And if you're 80 years old and you got a body that's relatively fine and no major problems, and if you got a good outlook on life, you're going to be doing a lot of things that you still enjoy. And you know, for the 60-year-olds and 50-year-olds, you know, you might not. And that's, that's a shame, because again, we sacrifice our entire life to get to the point where we want to retire, and then how do we enjoy our lives? We golfing, dancing, fishing, the yard work, doing the things that we want to do requires a healthy body. So we've all had this happen, right? Where we're driving in our car and we see that check engine light come on. Who would, when they see that light come on, just open up the glove box, grab some black duct tape, and just cover that check engine light and just keep on driving your car, right? You would never do that because you need your car. But what about your body, right? What is it about our body that's important to understand? We only get one, right? A car, you can even buy a new car, but with the body, you can't. And so why don't we treat our body with the same type of respect that we do with everything else? And I think it's because of the way we've been programmed to think from such a symptom-based healthcare system. And I'm trying my best to change that, folks. So what are our options at this point? Well, we can do nothing different, right? We can keep popping the medications. We can opt for surgery. And for some people, that is their only option, unfortunately. Or we can complement the body's natural healing abilities. And that's what we're here to talk about today, folks. So one of the big types of surgeries is a total knee arthroscopy or a total knee replacement, right? And this is a pretty intense procedure, and you got a long rehab road down ahead, no guarantee of results, large complication of failures and issues, and many people it doesn't work. And don't get me wrong, there's a lot of people that it does, and I want people to understand, knee replacement can be phenomenal to a certain extent, but it could also kill you. And they did a study on 18,000 people, and 30 days following that, men and women, 1 out of 400 people actually died. And this was a little large sample size, and that's from all-cause mortality, from all possible complications that could arise. So those are some statistics that I wouldn't want to gamble with, and I wouldn't want anybody else that I cared about or anybody really in general to gamble. We look at the cost too as well. Yes, insurance covers it, but how much out of pocket are you having to pay between the deductible and between the co-insurance? It ends up being a lot. So for our back pain sufferers, Crooked is a phenomenal book that I recommend that you share with your loved ones or check it out yourself too as well. But it really opens up your eyes to the reality of the back surgery, back fusion industry. It's got a low success rate, about 33% on average, and very high cost. It's just atrocious. The FDA has said that the risk of heart attack and stroke can occur as early as the first weeks of using an NSAID. And this is the stuff that they say is okay to take every single day. It's not. It's not. There are some long-term repercussions from this that may arise. And cortisone, which I think is the bread and butter of what medical doctors like to administer for joint-related and soft tissue damage. And the problem with cortisone is you're treating an area that's in pain from breakdown of the tissue with a product that actually breaks it down at a faster rate. See, I'm not okay with that. And a lot of our patients feel the same way, which is why they're reaching out for therapies like this. So what is this therapy? Well, this therapy comes from the placenta of a healthy baby birth.
It's the amniotic membrane
Of that tissue, and there's regenerative properties, all sorts of different regenerative properties. You can see here in this well illustrated picture that I have here of all the different components in the cellular matrix that all contribute to this beautiful effect that we see in soft tissue when we administer this product. So there are all sorts of different growth factors. I'm not going to get into the growth factors, folks, because you can read it here, and quite frankly, I think all that matters is that you understand that there is some growth factors in this product, and growth factors do what the name implies, is they play roles in the growth process, which is what we want. Not the opposite of like what cortisone does, which is a breakdown. We want some growth. We want some regeneration, whether it's happening from the product or whether it's from our body being aided to heal and regenerate, which is really what this product does. It's a very easy and seamless procedure. It's a simple joint injection or a muscular soft tissue injection. You're going to have some soreness possibly for a couple days. You avoid the non-steroidal anti-inflammatories for a few weeks, and you take it easy. I mean, it's pretty straightforward. A lot of patients watching this have had a stem cell procedure in the past, so it's very similar. This is not a stem cell therapy product, and I want to be clear. This is a stem cell recruitment product, but nonetheless, we treat it very similarly. All these different regenerative medicine procedures is we want to let the body rest. We want to avoid anti-inflammatories, but we can take Tylenol if we're in a lot of pain, or we can do even better, take some powerful anti-inflammatories like turmeric and resveratrol. So saying no to amniotic fluid tissue injections is like possibly saying yes to more drugs, more steroid injections, and more surgeries. And I think we're tired of that, folks, and we're looking for alternative solutions. So patients have reported pain relief with this program from the following: tennis elbow, shoulder issues, joint pain and arthritis, knee pain, knee arthritis, Achilles tendonitis, lots of different tendinitises and tendinoses, and various issues of the back too as well. Everything is going to depend upon medical necessity. So you got to get in for an examination. So what now? Our program is for the potentially healing of soft tissue damage. But you got to call us today to see if you qualify. And really that's all it takes is you come in for an examination, you meet with the medical staff, and then we're going to do a thorough examination and send it off to Medicare so that we can see if you do have some potential benefits that can apply for this therapy. So please reach out to us if you don't already have an appointment. We probably have been trying to reach out to you as well. But if you haven't heard from us, give us a call. All this craziness in the world right now is, I think, starting to go behind us. And so for the patients out there that have been on quarantine or lockdown for some time, I think we're all ready to get out there. And as long as you are in an area that is okay with like our areas here, depending on what date you're watching this, of course, but as long as you're in an area that's still not on lockdown or quarantine, by all means, give us a call, and we'll be happy to start this process and potentially make a huge impact in your life, guys. So I hope you found this informative. This is Dr. Jones checking out, and we'll see you guys in the clinic. Thank you so much.
It's the amniotic membrane, the amniotic tissue